Hi, my name is Dr. OMD. I'm a board certified family medicine physician and a current sports medicine fellow. Want to learn more about me or my career? Check out my interview with the Medicazone.
Hello, Dr. Folk.
Hello, hey, how's it going?
Good. I'm going to ask you about 7 questions from a bunch of different subgroups, so education, training, career development, and stuff like that. So just answer to the best of your abilities and yeah. So,
Mhm.
can you describe your journey from education to your current position?
It's been a long journey, educational wise and just in general, different experiences that I've had. In high school, I started off with HOSA, which is Health Occupational Students of America. It's a health occupational organization for both high school and college students, and I'd say that would be my first, real like work experience within the healthcare field. I grew up in a household of people in the medical field. My mother has her own, eye care practice, and then also my from other family members who in the medical field from MD or just like nursing. So I had that exposure in the household, but as I grew older, I got into my passion about learning about the body, science, and medicine, and I was also a really passionate athlete, and I felt like sports really taught me a lot of different things and skills that are still I still find myself applying today in my own profession, and I just felt like it was just a huge part of my life and me developing as a person and a human, and so many different aspects of how I treat myself and approach things professionally that I kind of grew to merge my interest within learning about the body and also sports. And throughout my time in my educational career, it took time to do what I could to learn a little bit more about the body. Eventually got involved with the ACSM and started doing personal training after college, and then even got a graduate degree in public health and learning about healthcare in that aspect, and also health management, and then going into medical school, continuing that passion. And once I got into medical school, I had a good idea that I wanted to be involved within sports medicine. I think being really active in high school and competing in sports, I did have some injuries that kind of uh, allowed me to spend some time with sports medicine physicians within the orthopedics and physical therapy. So I felt like that really kind of uh, honed in my interest from early on, like knowing that I wanted to do sports medicine. And once I got into medical school, the only other question was like, okay, what route in terms of specialty should I go to get into sports medicine? But I eventually chose family medicine for various reasons, um, and I felt like that was the best choice for me to get into the sports medicine field. And I did my sports medicine rotations throughout residency with the DMC, and even did some away rotations with Houston Methodist in Texas. That kind of just solidified my decision. And after I finished my family medicine residency, I applied for a sports medicine fellowship, and I got matched with AHN Sports Medicine over here in Erie. So that's where I am today, and basically really glad about the experiences I've had you know to do to get along to this path. But I'm also more just excited about the opportunities ahead and willing to give my advice in any way I can to people who are trying to continue that same path.
Yes, really appreciate that, especially as the younger generation. I'm wondering, this is just a sub question, what geared you towards like orthopedics or the medicine route rather than just like physical therapy or like a PT?
That's actually a really good question because I get that question a lot. I mean, there sports medicine is such a huge field that there are so many different like members of like a sports medicine team or staff that you can really do so many different things, from so many different like team members, right? But at the end of the day, it's all about what's the scope of practice that you want and for yourself, right? And I felt like with me, number one, being a primary care physician, getting especially within family medicine, where you're working with all age groups, it gave me like a broad viewpoint on medicine in general because you're the entry point into the healthcare system of understanding the patients from their not only their medical history, their social history, the community itself. So and then also learning how to manage uh, and follow up with patients. So I felt like that was something that was very essential for me in what I wanted to do in my practice. And in terms of sports medicine, I felt like you not necessarily, you're not doing everything, but you have a good understanding of a lot of different angles and viewpoints from each team member within the sports medicine team. You know a little bit more about like you know a lot about like the rehab protocol, injury prevention guidelines. You know a lot about physical examination. You know a lot about anatomy, radiology. You know a lot about primary care and internal medicine. You know a lot about how to treat emergent and urgent uh, cases that you would see similarly to what you would see in like the ER, and you also know a lot about women's health. You know a lot about pediatrics. So it's like you get this huge and like broad perspective that I felt like in a lot of other fields you don't really get that same broad perspective in addition to also being trained in knowing about how to do certain procedures and also approach things from a different way. It's the knowledge base, it's the skill set, it's the experience, and it's also the amount of autonomy that you have to do grow your practice and see different patients from uh, different patient populations, if that makes sense. So I felt like going into sports medicine as a physician specifically allowed me, or it gives you a lot more opportunities to do different things and from practice, and then also you're not as limited and restricted in certain areas. So I felt like that was the best route for me, and I felt like I wanted a more holistic um, approach to practicing sports medicine that I felt like me as a physician going through medical school and then my training allowed me to have.
That does make sense. Thank you. I'm just wondering, I guess whenever people are planning to go to med school or I guess anything in the medical field in general, like med school, PA school, stuff like that. I'm just wondering, how exactly did you, I guess, find a balance between your extracurriculars and your school life, and how did you balance those two?
Yeah, that's and also another good question. I felt like e- balance is a tricky thing because you're never ever going to be 100% balanced at doing all the different things that you're interested in life, whether it be your family life, your own personal interests, your work, your school. Like there's you're going to have to give something somewhere. But I felt like growing up as an athlete, what I was taught, that I still kind of keep in mind today is that, you can't control time, right? We as human beings can't control time. What we can do is we can manage our focus, right? And once you know, like, okay, these are the things that are very important to me, my close relationships, like, hey, are you, if you're married, like, you have a wife and kids, or close friends, like those are people who are important to you. You also have your own passion and purpose in your career that's important to you. All right. So you have this amount of time in the day. How do you prioritize and manage those things that are important to you? Like, okay, so now you know what's important to you, and you know that, like, okay, I only have this amount of time for this day. I want to make sure that I'm at least giving something and being present for those things in some shape or fashion throughout the week, right? And as long as you keep that in mind and you set your proper boundaries for yourself and others, and then you continuously make sure that you're being aware and present and taking time to reflect and enjoy the good things in life as well as the passions and the necessities that you need to do in life. I think that's all you can ask for, right? You always got to keep in mind that, especially along this path in medicine, like it's a very time consuming path, right? It's a very arduous path. There are some times that certain things might have to be fall to the side, but you always have to make sure that you're still giving time to those things to help you, relax, decompress, de-stress. So even like me, like uh, growing up, like I trained and I worked out year round, right? Like from high school to even some parts of college, right? But when I was in medical school, when I was on surgery rotations, right? Obviously if you're doing surgeries or you're on call for a 24-hour shift, you're not going to be able to do those things that you used to be able to do. So I had to even sometimes throughout the week kind of be a little bit more crafty on like, okay, how do I want to make sure I'm still eating right. I want to make sure I'm still being active. I want to make sure I'm still like having time to maybe like catch up with friends or family, right? So like even times like when I come home or I'm off of work, I pack my gym bag with me. I go straight to the gym, or even like if I don't have time to go to the gym that day, I make it a habit to keep my workout stuff near my bed, and I can do a quick workout before I go to bed. Right? It's like being knowledgeable about the things that are important to you, and then kind of finding a way to make those things that are important to you work within your schedule. So it takes time, right? But again, if you start to build those habits early, then as you grow and you adapt to different situations, different environments, you'll be able to learn how to manage those things more effectively.
Yeah, that's really good advice. It's good that you at least it's good that your I guess stress reduction method is also technically good for your body because
Yeah,
that kills two birds with one stone.
yeah.
Okay, next question. What quality, just one, do you believe is essential for success in healthcare?
Resilience, resilience, 100%. Because in medicine, you go through so many different things, whether it be through your training or with your patients, or even in just your everyday life, that are very difficult to deal with. You could be going through a specialty, and that specialty is adding on different things from the requirements of like training, the things you need to do, the things you need to keep up with CME, you having to do certain things like admin wise, right? Or just the patient population you're working with. They have so many different like demands within that patient population that you have to keep a strong head and keep in mind like, okay, every day is not gonna, with every patient, it's not gonna be perfect, right? And some days might be harder than others, but you have to keep in mind that like, okay, well, as long as you're keeping in mind that I want to make sure that you know the the better times are outweigh like like the lower times like in your career and your day, then you make sure that you keep those things in mind and keep pushing forward, because it's very easy to get bogged down in a lot of different things going along in this route, whether it be with your education, the testing, the training, um, and then keeping up within the different aspects of your profession, your personal life, that can be draining, like emotionally and physically. But if you always try to come back to thinking about like, okay, why am I here? Why am I doing this? Why did I choose to be here? Well, what am I hoping to gain out of being here, and what sort of positive influences am I leaving by doing this job? And you also have to continue to think about, you know, what can I control? What can't I control, right? As long as you try to, take control of the things that you can control, and realize that there, certain things in your life, in this profession, or in just in general, that you have no control over. But as long as you can maximize those things, you can take control over, and you can try to make as much positive out influence as you can within the things you can control, then you can be good with that. You can live with that, right? So that's what I try to keep in mind.
That's really good advice. Thank you.
Mhm.
I guess that kind of relates to the next question I'm about to ask, but what's one piece of advice you wish you had when you started out?
Finding like a mentor, like who really understood, and I could feel like had a rapport with the journey that I was trying to go on, right? And if you can find a mentor who's in a position or a similar position to where you want to be, and they've already gone through so many different things, they have had their ups and downs, and they can kind of either coach you or counsel you, or kind of just provide you advice on more effective paths to do certain things, or even strategies or resources, or even networking opportunities. I think that's just going to put you in such a better position, and it just uh, limits the time that you have to take to get towards a particular path, in my opinion. So I felt like having a mentor at a maybe an earlier age would have been, or just for in general, anybody in the medical field, is something that's very vital.
Yeah, that makes sense. I guess to build on top of that, how exactly would you go about finding mentors or even just trying to get any patient care experiences, um, shadowing, stuff like that?
Well, it's definitely specialty specific. The organization that I was in, like HOSA, that was actually a really good organization. If you're in high school and you're trying to get involved or get connected with healthcare providers to do some sort of shadowing, that's what I'd recommend. And then another thing is, like, I mean, there's other outlets, especially, I mean, I can take sports medicine, for example. Like, if you're about to graduate from high school, and you get into college and you're interested in sports medicine in any capacity, it doesn't have to be like a physician. It could be a physical therapist, or any other member of like a sports medicine team. You could technically get like a certification and like some sort of like personal training certification, and get connected with a gym, or even maybe a therapy center, where you could get some work in, and kind of harness that knowledge that you just learned, and then build upon that, and find networking opportunities through other healthcare professionals, healthcare providers, or maybe just even build up your own personal service, or like if you feel like that's going to be your niche, as you continue to build your certifications and your training. So definitely getting connected with healthcare organizations, or getting connected with like gyms or clinics or hospitals, or even there's even sometimes I remember when I was in graduate school, there was a free medical clinic. It was like a medical clinic that serviced the homeless population within the town that I grew up in, that I got involved in, and it was through there that I got connected to medical students who were at TCOM, who were doing rotations through there, and that allowed me to get into, like, that gave me more information about the public health program. So just even like putting yourself out there for different experiences like that can help you get connected to potential mentors or even networking circles with that have potential mentors in them.
I'm just wondering, would it matter if these positions are paid or not unpaid?
When you're starting off, obviously, if you could get a paid position, that's obviously going to be a plus for you. But if you're in high school or college, I wouldn't, and you're trying to go into maybe a certain like professional field, whether it be in the medical field or within like the MD or like allopathic or osteopathic or PT school or even OT school. You don't necessarily have to have like be in like a paid position. If you could do some volunteer work, that would be great. But like again, like I said, if you want to have some sort of like payment or like a paid position that you can do that's related to that, getting like a certification, because that doesn't require you to get a degree. You can just literally go to some of these national organizations that have offer certifications, and they give you like minimum requirements. So that you have to have like a high school degree, and that's be a U.S. citizen, and just very simple like qualifications that you can already go ahead and apply for or study for and take a test for, and you can get that certification, and then now you can kind of leverage that and go into a space like a gym or a clinic, and work as some sort of medical assistant or a trainer. So there's different ways you can strategize to it, but the main thing is putting yourself out there and getting opportunities that get you exposed to that field as early as possible.
Yeah, that's good advice. I know a lot of people usually start a little late and then it's always really stressful to try and get those hours that are, I guess, sometimes needed. Can you provide an example of an ethical dilemma that you faced and how you resolved it with a patient? If that, I guess, applies to sports medicine, I'm not sure.
Yeah, I mean, there are definitely ethical dilemmas that you run into, whether it be in the primary care setting or sports medicine. I can recall um, certain situations when, especially when you're dealing with like an adolescent, and you, the patient's parent comes in with them, and they give you an understanding that like, okay, this, their son or their daughter is going through certain things, whether mentally or physically, and that might be sensitive, and then you tell them, okay, well, do you mind if we kind of talk privately? And you can recall like some situations where the child tells me about something that they're struggling with mentally and that they might harm themselves, and then because we're always want to reiterate to them that like, okay, certain things, especially like, confidentiality is very huge in medicine, but when it gets to that point where it's like, okay, well, they're thinking about harming themselves or maybe harming somebody else, and that's when we know like, okay, we need to, especially if they're a minor or adolescent, and bring in the patient's like guardian to the situation to let them know what's going on, right? So there are ethical situations like that you'll run into, but as when you get experience in learning the nuances on them, you can kind of handle them accordingly.
Yeah, that makes sense.
Hmm.
Okay. On that note, I think we are good. We as the Medica Zone really appreciate you coming here and sharing this with us. This interview will obviously go to all of our members, and it's really nice to be able to hear advice and also have someone so willing to. I know a lot of people usually are like, no, like, don't have time, and it's
Hmm.
really valuable when we have a real physician coming on and sharing their advice. It's truly very what's the word? It's just very valuable to us, especially because we obviously don't, not everyone has like direct connections to physicians. So yeah, we really appreciate it to say the least. And yeah, I hope you have a good day. Thank you so much.
No problem. Anytime. Thank you for inviting me.
Yes, of course.